We're going to talk about ice now and icing and how to use it at home to help you self-manage your home injuries. And we're here with Dr. Scott Timko. Scott, thanks for coming.
Thank you for having me. I appreciate it.
Very good. I noticed that we have a couple different ice packs here, but before we talk about that, when would you use ice? What would you use it for? What are the conditions that are required for that?
Typically, ice is utilized for cases of inflammation, and that could be a sprain or a strain injury, a fall. We can even use it in chronic conditions that have flared up. For example, a low back pain that has all of a sudden gotten worse, and now we have some radiating pain. But the key thing with ice is it does reduce inflammation, and that's what we utilize it for.
What is inflammation? I think it's really important for our viewers that they understand what that is and how to recognize what that is.
Absolutely. Think about if you sprain an ankle, for example. What inflammation happens is you get swelling around that joint. You'll also get heat released from that area. The area may even turn red, and of course there's pain involved, and those are all signs of inflammation.
I see. And I frequently in my office will have patients that come in who tell me they've been using heat. Why wouldn't you want to use heat on that type of an injury?
Well, if you think about the signs of inflammation that we were talking about, part of that was we already have heat in the area. We already have the swelling and the inflammation in there. So if we apply heat to that region, we're just going to be exacerbating or making that worse by increasing the problem that's already there in the first place.
I see. And so what will the ice do?
The ice does the opposite of the heat, is it actually causes what's called vasoconstriction, which constricts the vasculature or the blood vessels, and it pushes that inflammation out of there. It reduces the heat in the area and will also eventually numb the area, which decreases the pain.
Gotcha. And when you're going to use ice, how would you apply it? What are some of the time frames? If you can share with us some of that information, because I think that's going to be most valuable for our home viewers.
Absolutely. The first thing you need to do is make sure you have the right size ice pack, because you don't want to over ice an area that doesn't need it. So for example, a small area like a wrist or an elbow would use a pack like this one to cover that area. A little bigger area, maybe the back of the neck, we could utilize an ice pack such as this one. This type of ice pack is great for headaches because it can be placed across the forehead and then across the temple region as well, and it can reduce the pain from headaches. A larger ice pack such as this one is great for the low back or even for a thigh region, gluteal region, something along those lines.
I noticed this one has a little cover on top of that. What is that for?
Well, you never want to place an ice pack directly on the skin. You can actually get ice burn on the skin, and you can cause damage to the skin in that area. And so we always want to use some sort of covering between the ice pack and the skin. We don't want to use something too thick though. Something like a towel may actually be too thick and not allow the cold to penetrate. So something along the lines of this is nice and thin. It's about the width of a t-shirt. So if you don't have a cover on your ice pack, a t-shirt or a paper towel, something along those lines will suffice.
Perfect. And so for a larger area like this, do you ice for a longer time frame? Or for a smaller area, a smaller time frame? How does that work?
Yes, it depends on the area and the body mass. So for example, a wrist that doesn't have a lot of tissue over top of it, we would use ice for a shorter period of time, possibly 15 to 20 minutes. A larger area like the low back or the thigh, we would increase that icing time upwards of 25 even to 30 minutes.
I see. And that allows for penetration into the deeper tissue then?
Absolutely. And again, the whole idea is to get that area, the inflammation out of there. And the stages of icing, if you will, is when you first put the ice pack on, obviously you're going to feel cold. That makes sense. As time goes on, you may feel a burning or even a tingling sensation or a pricking sensation. That's normal as well. The third stage is why a lot of people don't like to use ice, because it actually creates an achiness in the area, sometimes maybe increasing the pain, and so people think they're doing something wrong to themselves. But once we get through that stage, we get to the most important stage, which is the numbing part of it. And that numbing is where we want to get to. So whichever area you're applying that ice to or the gel pack to, we want to make sure we're getting to that numbing region, and that's typically between 15 and 30 minutes.
Very good. I think that's a really important concept and key to understand, is knowing that you have to get to that numbing stage before you're going to get the true physiologic benefits from the ice.
Absolutely. A lot of people don't like ice. Heat definitely feels better, but as we mentioned earlier, if we use heat, we can actually inflame the area more.
Sure, sure. And so when somebody has an acute injury, a new problem that tends to show up, what should they do? I know that there's an acronym, and if you can share that with our viewers, how to follow that acronym and what to do.
Absolutely. That acronym is RICE, R-I-C-E. The RICE stands for rest, or the R in the RICE stands for rest. And certainly anytime you injure an area, you want to rest it, get off it. For example, of an ankle, you want to rest as much as possible. Sometimes even crutches or something may be necessary. The next part of the acronym is the I, and that is the ICE. And certainly using ICE or a gel pack such as this is going to be very important to reduce the inflammation. The next letter in that acronym is C, and that stands for compression. And we utilize something along the lines of a ACE bandage or some sort of compression bandage on the area, again with the idea of reducing the inflammation. And then the fourth part of that acronym is the E, and that stands for elevation, where we want to elevate that area above heart level, which again helps decrease blood flow to the area and reduces inflammation.
Very good. So what I'm hearing saying is kind of an overview is, for a new injury, definitely we want to use some ice on it. Don't use heat because that can increase inflammation.
Yes.
And then you said we want to rest it, ice it, compress it, and elevate it.
Absolutely.
Excellent. I don't think I have any more questions. I know that in my office, this is one of the key things I provide for patients as far as home care. It's really important to take care of yourself outside of the office to help what we're doing in the office accelerate healing and accelerate their care plan.
Yeah, I couldn't have said that better. That's very important. We supply these gel packs at our office as well, and that's one of the key things that I have my patients doing when they're at home, along with their stretching and maybe some strengthening programs as we move along. But initially, ice is the key.
Excellent. Thank you so much for your time, Scott. I really appreciate it, and I know our viewers are going to get a lot out of this.
It's been my pleasure. Thank you for having me.
You bet.